Welcome and good morning. This talk is intended for nursing informatics leaders who are building the technology, framing the bedside nurses practice today. My name is Courtney Rosenthal and I am a nurse educator and clinical nurse 3 in a surgical trauma ICU at a level 1 trauma center in Charlotte, North Carolina. I've been in practice for about 6 years and am dual certified in critical care and trauma nursing. So today we're going to talk about the role of technology in patient safety. We're going to talk about an example of a safety system that is in place at my facility, and we're going to talk about its successes and maybe where it could be improved. So patient safety is an intuitive role for technology in the healthcare arena. A standard currently at use in my facility is called incident reporting. And incident reporting is this anonymous system which allows any member of the staff to create a record of an event. Even where no harm occurs, something called a near miss is encouraged to be reported. The incidents are tagged to the units that might be responsible, and in many ways it's an ideal system. An example where the system worked was when a nurse caught a mislabeled medication from pharmacy. So in this example, a pre-mixed solution of Levaquin was incorrectly labeled with a computer-generated label of levetiracetam. Because Levaquin is a yellow solution, the experienced nurse took pause and read the manufacturer-generated label, not the computer-generated label. She caught the mistake and created an incident report. The report allowed the nurse to identify the care concern and send it to the correct department, so it went both to the nurse manager and to pharmacy. And in this case, the reporting led to a big investigation of the labeling practices in the pharmacy and also resulted in education to the nurses to increase awareness in checking medication labels and the hierarchy in which to scan labels, starting with a manufacturer-generated label, following only if necessary by the pharmacy-generated label. So this is an example where everything worked, but in many situations, particularly those in which harm does occur for the patient, the nurse is correcting the errors and they're busy, and the nurse does not have time or necessarily the incentive to self-report the error. For one, the form is arduous and not intuitive. It doesn't slave over any information from the EMR, and so the nurses are required to sometimes duplicate or even triplicate their documentation. Further, the nurse's information might not be accurate. They're asked to evaluate the level of harm that came to a patient from none to severe when we may not know for days the result of a patient's fall or a medication error or a faulty piece of equipment. While real-time documentation is important, there's no opportunity to follow up and update this incident report. Another weakness of this form is that it can only be opened by a certain browser, and it's a different one from which many nurses routinely use. And there are separate login screens for this form, and so click fatigue sets in by about the third screen loading. The biggest weakness is probably that it's merely a report, and so it's just raw data, and it's up to the person receiving that report to take that data and synthesize it and turn it into meaningful knowledge and wisdom. So what can we do to improve it? Number one is interoperability is critical. Allowing nurses to work within one system saves time and decreases the learning curve for filling out the form. Incident reporting should be a direct link from the EMR, and that would allow nurses to skip the burden of clicking out of the EMR and entering a new interface. Second is the minimization of the replication of data. Nurses are overburdened by documentation. Patricia Singstack is a nurse informaticist and a chief nursing officer who noted in one study that nurses are entering on average 14 different screens with 153 required fields and an average of 539 key clicks. More disheartening, she noted that only about 25% of this data is actually useful or meaningful to the nurses. We have to find a way to prune unnecessary documentation from the nurse's workflow. There should be a way to pull information from the EMR without necessarily entering the incident reported to the EMR. The last thing is that there need to be clear outcomes generated from these reports. The person who receives the data needs to action plan each item and share those actions with the staff so they can feel the meaningful impact of their work. It's going to increase the likelihood of the reporting. There's some research by Farag et al., which found that a transactional leadership style, which is one in which expectations and follow-up are central to the culture, resulted in an increase in self-reporting. So only with follow-up will nurses see the importance of incidents reporting. Technology has provided many safety checks and are improving the care that patients receive. However, technology can and should always be improving. I'm asking each one of you to rise to the challenge to make patient safety more integrated into technology in a meaningful and productive way. Any questions? Thank you.